Hey, this is Doug Field along with my co-host Brent Macy, and welcome back to the final segment of Healthcare Consumerism Radio. They always say you save the best for last. I think we have with this segment. We've just had a conversation today with, ABHSA Council getting their perspective. We talked to Josh Hilder at Private Exchange. Well, inside exchanges, and a critical part of exchanges is the health plan itself, as well as operating outside the world of exchanges. And joining us to really talk about where we are today and where we're going from his perspective is Craig Hankins, the VP of Consumer Engagement Products at UnitedHealthcare. Greg, good morning to you.
Good morning, guys.
Nice to have you here. You up in,
Thanks much. Good to hear your voice.
Yeah, you up in Minneapolis?
Oh, yeah.
What's it like in Minneapolis today?
It's a little gray today, but not yet quite fall. I think that's coming, though.
Well, we'll let you brighten it up with your perspective on, where we are today. I think you talk a lot about achieving health ownership through plan modernization and consumer tools. Talk to our audience a little bit about what you mean with that.
Yeah, so what we mean by that is that we're seeing a lot of employers now, as they've moved into CDHP, some are still moving in, some are moving, beyond. But that what we've really seen and what we're really working with our employer customers on is how to modernize their plan, as we term it. And what that really means is helping the employers view and use their plan design and benefit programs to establish a health and wellness strategy that helps their employees and their family members move from being passive healthcare consumers to individuals that, as we described, take on health ownership, right? They start taking responsibility and feel accountability to themselves for the health decisions they make.
Now, Craig, are there some certain initial steps that you guys always focus on that kind of help the employee consumer move down that path?
Yeah, good question. So what's really foundational to achieving health ownership is the adoption of a consumer-driven health plan. HSAs or HRAs, as you well know, are proven to engage consumers. And so that's quite often the foundational step that we work with employers to move them into, whether it's some of the employers are only just now introducing an HSA or HRA to their employees. Others are moving into full replace. Mm-hmm. The ideal being going into full replace where CDHPs are the foundation for their health and wellness strategy.
And are you seeing more and more of your members or your employer clients who are moving to that full replacement strategy given the current climate out there?
Yeah, we are. We've had about 20% of our larger employers that were already full replace CDHP, where that was the only plan they were offering. Mm-hmm. We actually are having many conversations in the past year, and I expect that will continue as more and more employers make that move, where they just move the rest of their population in, and then the focus becomes on how do you optimize that, how do you move beyond, because as we look at employers that have really moved down that path and modernized their plans, not just around the CDHP, but the programs they pair with it to drive use of high-quality physicians, for example, or through components like network design, or offering targeted and engaging clinical and wellness programs. The employers that move to modernize their plans and full replace CDHP is a core component of that. They're seeing costs that are 24% less than the employers that have not taken those steps. And while about half of that cost is due to the shift into a full replace CDH environment, right? So that's coming from benefit design changes. The other half of that savings comes from the better decisions that these people are making. They're getting more of the right care at the right place and at the right cost, and that reduces the cost for the employer.
Yeah, I think, and you and I have talked about it. This is Doug, and you and I have talked about it many times in the past. It is about what you're saying, enabling employers to create better consumers of health and healthcare. I mean, that's the holy grail. If you achieve that, you're going to lower your healthcare costs, and the employers are going to embrace these plans and the choices they make. You agree with that, Craig?
Absolutely. That's really what we're after, right?
Yeah.
Because at the end of the day, cost is critical, but I would say a lot of employers they really care about their employees, right?
Sure.
And they want them to be healthy and productive, and a lot of that just has to do helping them kind of wake up to the fact that they can take more ownership of their health care. But it's going to take a little effort on their part, and the old kind of plan designs really insulated people from that, and didn't give people much of an incentive to do things differently. And once they start changing, they realize, hey, it takes a little getting used to, but that's where the communications and the tools come into play. And then they realize, hey, we can really do this. And a lot of people are really happy in the HSA plans, but it does take a little bit of transition.
Yeah, it's interesting, Craig, and we've had a couple on the program recently. It's interesting. I see this particularly with the jumbo employers out there bringing onto their teams consumer marketing experience executives, not necessarily benefit executives, but consumer marketing experience executives to lead these engagement initiatives. Yeah,
we're seeing much the same, and we also have in-house some services we provide to some of our clients, and these employers, that's really actually one of the best practices that we've seen that drives to some of that difference in savings is employers that are able to apply some of those practices from consumer marketing to how they sell their health and wellness programs to their employees, whether it's going into and getting them to enroll in an HSA or getting their biometric results, taking those cues of branding the whole effort around health and well-being, around having a structured communication plan with goals, and it's ongoing, and you've got metrics you can track to. And one of the measures, too, that we found is really important is not only having the HR team really get on board, everybody, whether especially if you've got a distributed workforce, as a lot of employers do these days, but also the line managers, getting the line managers to understand why this is important. It's not just a cost play. It's about, as I've kind of heard some employers describe it, it's a different form of paternalism. Paternalism used to mean, hey, you've got really rich benefits. Now it means we really care about your health and well-being, and we're going to help you get get aware of that and understand what you can do to be healthy.
Hey, Craig, what do you see as the impact now and in the 2015 plan year around these initiatives with the emergence of the private exchange and defined contribution model?
Yeah, we're actually seeing, a lot, as you probably know, a lot of employers are looking at, are the exchanges right for them, evaluating the alternatives, and what we are seeing are some employers who are looking at the two, and actually, whether it's going CDHP and going full replace, and really taking on that ownership strategy and owning themselves as the employer, that ownership strategy versus going down the path of the exchanges. And I've actually seen, I recall one employer in particular that said, you know what, we don't want to go down that path. We want to keep owning and engaging our employees through the plans and programs we offer to them, and there was kind of a paternalism play there. Is that they're important to us, and this is an important part of not only how we compensate people, but the relationship they had with their employees. So they decided to go full replace HSA rather than the exchange.
Yeah, we see a lot of that happening too, Craig, and we actually see employers having what I call the opportunity to play that card this fall and move to a full replacement program and, in essence, say, hey, we're not going to dump you in exchange. We care about you. Here's our new program surrounded with the various services. I think you're saying the same thing. You're seeing the same thing out there.
Yeah. Well, we are. I can't speak broadly about what a lot of employers are doing. I know there are some that are choosing to move towards the exchanges, but a lot of our conversations are really around helping employers understand, okay, well, what can you actually do more than you have been doing? It is prompting some of that thinking, especially with the additional costs associated with PPACA, that they're trying to say, well, maybe now we really do need to move rapidly into a CDHP. Even some of the employers that, as they looked at CDH, over the past 5 years or whatever, and they were kind of saying, it's not really for us. Now some of them are really stepping up, saying, you know what, it's time. Let's do this, and let's do this in a significant way.
Now, Craig, we got about 30 seconds left. What's kind of the one takeaway that our audience needs to know if either they're looking at a full replacement program or if they've got a program already in place and are looking at engagement options for them?
I'd say really understand your population and design the plan in a way that's best for your employees, both from an actuarial and underwriting, but also from a kind of health literacy kind of perspective, and then drive the communications. And then once that's in place, help them use the tools, help them know about the tools that are out there for them, whether it's mobile apps or cost estimator capabilities like we've got with our own My Healthcare Cost Estimator. These are the tools that they're going to need, that their employees are going to need once they're in the CDHP. Mm-hmm. And so it doesn't stop on January 1 or whatever their effective date is. It keeps going.
Well, Craig, thank you so much for joining us on the program today. To our audience, Craig is actually going to be doing a breakout session at IHC Forum West on everything we just discussed. So I do invite you to sign up for his breakout session. Craig, again, thank you very much. And to our audience, we will see you next Friday on Healthcare Consumerism Radio.